Changes to U.S. foreign assistance policies, geopolitical shifts, a global decline in traditional funding sources for global health, and accelerated demand for country-led systems have created urgency for companies and organizations to rethink how they partner, how they fund their operations, how they do work, and how they measure and achieve desired health outcomes. Many of the outcomes are human lives. The human consequences of these changes have become increasingly visible. Among the most valuable assets destroyed, beyond the devastating and unnecessary loss of life and livelihood, trust. The speed of change, including the expansion of Gen AI, left many companies and organizations reeling and at risk of going out of business unless they innovate to find new financing models or ways of operating and collaborating. For my leadership project, I set out to explore innovation in global health business models and partnerships. My name is Abbey Kocan. Among other important roles, I am the Deputy Director of the Bay Area Global Health Alliance. The Alliance is a cross-sector membership network that bridges technology, industry, and innovation with traditional global health stakeholders. With more than 100 members, the Alliance serves as a neutral convener, facilitating collaborations across sectors. Notably, only 1/3 of our 100 members are based in the San Francisco Bay Area, with a growing contingent, today 17%, based in low and middle income countries. For my leadership project, I wanted to build on insights from Alliance convenings and engage our broad network to surface ideas for business model and partnership innovation that would enable organizations to evolve and better achieve desired health outcomes, ensuring LMIC voices were represented and central in the conversation. This learning would feed into a concept note to secure sponsorship for a discussion series. But the reality? The ground was still shifting too much. Speakers were hard to secure, even for planning. In conversations with members, it felt impossible to look forward, and our very lean team at the Alliance needed to focus on activities that supported members where they were, activities to help ensure that the Alliance itself was sustainable. Taking a step back, the WomenLift Health leadership journey provided a scaffolding that created space as I moved through the range of emotions that many of us experienced throughout 2025. The journey created a safe space to authentically share my rage and frustration, and more importantly, to reflect on how the experience of those emotions affected me as a leader. The WomenLift Health and Center for Creative Leadership teams worked diligently to support our community and adjust the journey to accommodate fellows who lost their jobs or were in limbo. I felt supported to reflect on my personal leadership journey as well as my professional one, revisiting what I value and prioritize, the boundaries I set, and reflecting on the tools I have available to support me. Prior to the Alliance, I served as the executive director of a nonprofit and lacked many of these tools, which led to burnout for me and resentment from my family. The awareness and intention that I am bringing to my global health work and to my family and personal life is far greater today thanks to this journey and the assessments, resources, and discussions that explored what it means to be an authentic, inclusive, strategic, and impactful leader. Looking ahead, my project and the Alliance's role feel timely. Even with the uncertainty in the global health sector, the Alliance experienced membership growth in 2025, indicating that our theory of change is more relevant than ever. In October, related to my leadership project, I took the lead on a hybrid impact investing convening co-hosted with Accenture and the Global Impact Investing Network. There was high engagement from both our virtual and in-person audiences, indicating an appetite for more. Just this week, on a call with a leader of a large NGO, there was renewed energy and demand for exactly the type of conversation around business model and partnership innovation that I had set out to explore. We also reconnected with a South Africa-based member that plays a leading role in supporting LMIC governments to build visionary and effective teams. We are scheduling time with both members in January, with a goal to host discussions in Q1. Beyond the leadership journey, I plan to hold myself accountable by working in collaboration with other members and by seeking sponsorship to enable greater focus on these important discussions. I am closing out 2025 with exhaustion, gratitude, and hope for what will come next. Thank you to Sarah, our executive director, to everyone in my network who provided feedback on my 360 assessment, and especially to my family for granting me the time and support to embark on this journey. I am grateful and excited to build on the momentum that I am feeling today.